Google Hangout of the Partnership Center in partnership with our friends over at the Department of Homeland Security and here in the Assistant Secretary for Emergency Response and Preparedness. We're excited to be here this week because it's Hurricane Preparedness Week, and we also just wrapped up our first action step in our America's PrepareAthon. We are here today to talk about the National Health Security Strategy, and I'm super excited to have a good friend and colleague, Dr. Dan Dodgen, here with us. And we're going to start off with a question to him, because he's the director of our At-Risk Individuals Behavioral Health and Community Resilience Division in the Assistant Secretary for Emergency Response and Preparedness. And Dr. Dan, would you tell us, just give us a quick overview of what is the National Health Security Strategy?
So the National Health Security Strategy is a national strategy that's designed to help not just federal government, but the whole nation be better prepared for public health emergencies and the health consequences of any natural disaster, terrorism event, anything that could be an emergency for the nation. The National Health Security Strategy promotes that.
Great, thanks. And so, just quickly, if you guys, as you have worked on the National Security Strategy, what would you say is that the vision or the goal of the National Security Strategy?
So really, the National Health Security Strategy has an overarching goal, which is really to build community resilience. And I think we're going to talk a little bit more today about community resilience. But in addition to that, it has a number of strategic objectives, and one of the ones that I particularly want to talk about today is the strategic objective to promote informed, empowered communities. That's the first strategic objective, and I think it's the one that will be of most interest to the faith community.
We're not live. I just got an email that says we're not live. I don't know what that means, but does that mean we should continue?
So evidently
you are live. Okay, so we are live. Sorry, I promised you that this was the first broadcast. So and we're doing this as our first try. So thank you for being patient with us. So we are live, and everyone heard that. Woo! Okay. We are.
And thank you to the partners for good something. I can't see the rest for affirming that we're actually we're live here.
Okay. It was at okay. So we are live. So turning the time, we're going to just switch gears. So National Health Security Strategy has a vision that a secure nation is one that is resilient and has resilient communities. And we've got St. John Holloway, who is a high priest in the Mormon Church in Salt Lake City, and is an expert in emergency response and preparedness. And we've invited him here because we believe that faith leaders are often first responders in a host of different types of emergencies, not just the big ones that we were talking about, but the micro ones as well. And to turn some time over to St. John just for a minute about what the role he sees faith leaders having in during a disaster.
Thank you for giving me the time and inviting me to be a part of this. I think that one of the most important things from a faith-based aspect of what we can do in disasters on the ground as they happen, and also pointing out that there are always going to be issues in people's lives, and there are always going to be personal disasters, and we're not trying to detract from that, but talking about major disasters, the most important thing is to know who your neighbors are, to know what is happening in their lives currently and what those situations could do to affect their lives in a disaster, and how you can help them overcome the issues that they're facing. I think also something that we really try very hard to do in our congregations is prepare people. If you're truly prepared, then there's not really an emergency, it's just an event, and being able to overcome that event.
So what does the research tell us about the difference between communities that rebound after a disaster and those that struggle?
This is Dan. Let me start with that, but I welcome other people to say something as well. There's actually some pretty cool research that's been done in Japan where they've been keeping really good records of these things for a really long time. And going back to the 20s, there's research that suggests that communities that come back after a disaster is because they were more connected prior to the disaster. And connectedness can be measured relatively simply. For example, if people were members of civic organizations, that could certainly be a congregation, it could be some other kind of organization. Even actually being registered to vote turns out to not be a bad predictor because, of course, it also suggests some kind of civic engagement. So one of the things that I think we're looking at even now in research is not just what makes people resilient, but what actually predicts people coming back. What can we do ahead of time that we know research tells us will increase the likelihood that people are going to recover? Because we want communities not just to be resilient, but we want them to really be coming back and better than ever if possible, but certainly as good as before after a disaster. I think in Katrina we saw similar things happening where the communities that were very closely connected, for example, the Catholic Vietnamese community in the New Orleans area came back, recovered a little bit quicker, and responded a little bit more effectively because there were these strong community connections.
I'm curious to hear what Marcus Coleman has to say, and he's my colleague over at the Department of Homeland Security and works a lot with FEMA and is our lead in the America's PrepareAthon, and has had a lot of experience both in helping communities prepare and then, you know, been a responder and helped to organize in after many disasters. And Marcus, I'm curious to hear what you have to say about both the role of the faith leaders and then the differences you see between those communities that are able to kind of rebound faster and those that struggle.
For sure, thank you, and thank you for allowing us an opportunity to join you all today. One of the things that we found, I think throughout our time and throughout the research that's been developed is we've done a tremendous job and have made tremendous progress in terms of raising awareness in terms of being prepared. So many people that are on the Google Hangout today are probably familiar with the general 3 steps: get a kit, be informed, and make a plan. America's PrepareAthon really is about taking that next step and moving from awareness to action. And what we found is in communities that have close-knit ties, they may have been resolving another issue, in a way that you had the private sector working with the nonprofit sector, working with faith-based organizations, and when that disaster happened, all of that energy that might have gone towards other community issues have pivoted toward making sure that a community recovers. I think a great example of that is the community of Joplin, Missouri, which of course did a tremendous job in recovering, but it was in part because there were a lot of already close-knit relationships already established. And so it's more of an anecdotal thing at this point. I think that there's going to be more research that kind of reflects and reinforces what's being shared already, but I think a lot of it is communities that are already working together in a real way to solve some of the social ills and some of the social challenges that are considered day-to-day emergencies for faith leaders are typically in a best position to go ahead and meet the needs of those disaster survivors when they're impacted by a disaster.
Well, that kind of makes sense, right? If you can help people now, you can probably help people when they are in desperate need of help. Sinjin, the LDS Church is often one of the, not just a first responder in the communities that they're in, but even a global responder. And I'm just interested to hear some of the lessons that you might be able to share from a church that really is kind of outstanding in that field.
You know, one of the most important things in our faith is the belief that when we're in the service of others, we're in the service of our God. And that really rings true when it comes to emergency disaster response. It's always wonderful to see the articles that have been published and to see the examples as we go out, and we are usually some of the first people to get there and the first people that are willing to help. And I think that what that does is it allows us to overcome the barriers that are created in society just normally day to day. We realize that when we have a common goal, we can overcome many, many issues, whether it be issues of race or issues of faith. They disappear because we all have a common goal. And I think that that's one of the reasons we are so driven to do this, is because at the end of the day, the people that we live around are our friends and our neighbors, and they are our community, and we should be very strongly and socially engaged with them so that we can help them in times of need, and so that they in turn can help us. That's the beautiful thing about it. When you help someone else, they're more likely to help you or pass it on to someone else and thus affect lasting change.
The pay it forward, or maybe even instant karma idea. So what would you say is the difference then between the communities that you've seen that recover and those that either struggle or maybe like, because you can probably hear in Sinjin's accent that he is an immigrant from Zimbabwe, and just would love to hear kind of, from that breadth of experience, kind of the differences that resonate with you, and what communities can do too. Sorry, it's a complicated question, but what communities can do to pursue or kind of put forward that type of resilience.
I think the first thing, and this is the number one, is open your mouth. Go and talk to people, introduce yourself, find out who your neighbors are. Something that is actually quite interesting in the difference of what I see here as I live in America and what I saw back home, the fact that you could live next door to someone and never know who they were. It was quite interesting. We have very large walls, we have big electric gates, doorbells, and you didn't get to know your neighbors. In American society, traditionally, you get to know your neighbors because we are a very personable nation. We're really close. You see each other on the street, you wave, you say hello, your kids interact. So I would say that the first step is getting to know people, because you can't help anybody or expect anybody to help you if you don't have a relationship. Yes, there are times where that relationship is formed because of an emergency, but preparing is the whole point of this, of what we're discussing right now. If you're truly prepared, then you'll be able to overcome.
Well, and that's really an important message during Hurricane Preparedness Week, obviously, and a couple of us on this Google Hangout are from Arizona, and so we also are aware of the fire safety issues as well. And today we are actively using, if you're following us on Twitter, this is a little Twitter note, please use the hashtag #HurricanePrep. If you tweet or retweet our stuff, because we'd love for this to be part of that conversation as well. And if you are on Twitter, we are really hoping to have a little bit of a side Twitter chat about this, and we'll be sending information out, or may even be doing so now, I can't tell, and are welcoming your questions via that process. So Dan, I'd just like to turn the time over to you for a minute to hear a little bit about, you're a psychologist, and to talk a little bit about the kind of behavioral health preparedness. Like, what does that mean?
That's a great question. I think that a lot of times people are a little frightened by the concepts of mental health or behavioral health in a disaster. So I certainly want to start by saying disasters are upsetting, whether it's something relatively small, like a multi-car pileup, to something large that affects hundreds of thousands of people. It's upsetting. People shouldn't feel, that there's anything wrong with them if they're sad or angry or, depressed or stressed out or whatever because of a disaster. But having said that, I think that there are some really basic skills that people can learn that will help them to maybe take care of themselves, but also to take care of the people around them in a disaster. A good example of that is something known as psychological first aid. It's a training that you can take on the web if you want. It's really designed for any member of the public to take. I think it would be really useful for clergy to have it, frankly, not just in an emergency, but probably any time, because we all deal with crises, every day. But one of the things that psychological first aid really focuses on is what are the basic skills that you can use during an emergency to help keep yourself calm, people around you calm, and then additionally, what are some things you can monitor in yourself and in the people around you to know, like, okay, here's someone who's really having a particularly hard time, and they might need a little bit more assistance. It's called first aid for a reason. It's really equivalent to first aid. It's equivalent to Band-Aid and antibiotic ointment, etc. It's not equivalent to surgery. We're not suggesting that you can take a 1-hour course online and go out and prescribe, medications or antidepressants or whatever, but rather that you can using these skills, you can help the people around you. And I think that's really the basic message, that in a disaster, things can be tough. And the more kind of just basic skills you have to kind of help the people around you, the better off you're going to be and they're going to be. And it also allows you to kind of monitor how you're doing. And certainly, if people are interested, we can probably send out some links on the information via Twitter, or we can just post them later on. But if you look up psychological first aid on the web, you can find a number of free courses that would be available, many of which were developed by people with the funding from the Department of Health and Human Services here.
And then, Kimberly, can I add some additional points to that question?
Absolutely.
So I think when we talk about meeting the needs of a disaster survivor, faith leaders often are the focal point. And I'm sure, say, John can speak to this more directly. But often the focal point and are pulled in many different directions. And I think what we're talking about a little bit is twofold. One is, how can we help meet the behavioral and mental health needs of that disaster survivor specifically? We've produced some great resources, particularly out of SAMHSA, and then you have the disaster mental health disaster mental health helpline that is for disaster survivors. For those who may be impacted, it's a free resource. We'll provide that in a link as well. But I think to the doctor's point, we also want to talk about self-care of that faith leader, because they're typically the ones that are going to the meetings, meeting the needs of individual disaster survivors. And it's vitally important that we help those people that are helping others make sure that they not only take care of themselves, but that they remain energized and engaged for the long process. Because long after the cameras leave, many of those faith leaders still have a lot of challenges that they have to tackle. And so the resources on the behavioral health side are really important to make sure that faith leaders know who they can go to, but then also where they can refer with necessary, particularly with the disaster mental health helpline.
And this is Dan. If I could just add, the other great thing about this is these are skills you can use every day. And I'm a former chaplain in the juvenile justice system, and I guarantee you that I use crisis management skills all the time. So I definitely think that people shouldn't think about this as something that you would take the course and then never use. They really are skills that you can use in your daily life.
And Marcus, thank you so much for bringing up vicarious trauma and some of the and just kind of the toxic stress that faith leaders can sometimes carry that actually does have impact. And just to be clear, we recently published a blog called Faith-Based First Responders on mentalhealth.gov, where we talked about the fact that faith leaders right now, at least some studies are showing that faith leaders are twice as likely to be depressed as the general public. And the reason they extrapolate, the causes of that are around the stresses of work, a feeling of maybe not being worthy of the call, or struggling with their own faith as they witness the atrocities that sometimes man inflicts upon man, or that happens just naturally, and that can weigh on people. And there is even seemingly these ways that people are responding to this that is a retraction, that we're retreating away from each other. And I think what you can hear in our voices, I hope, is this need for us to reach back out to each other, and not in fear, but in trust and frankly in need, that we all need to reach back out to each other in some way to say, I'm here to help you. I might not always agree with you on everything, but I am your fellow citizen, and I'm your fellow American, and I'm here with you to help. And just now a little Twitter note. We would love people to also follow hashtag PrepareAthon and use hashtag HCLDR, it stands for Healthcare Leader, for any other tweets that you might be sending along that fit along those lines. Sinjan, go ahead.
Oh no, I was actually going to ask Sinjan a question. Sinjan, I would love to hear from the local perspective, or from the faith leader perspective. What progress do you feel like has been made in making communities more resilient?
I think a lot of progress has been made. I personally have had the opportunity to take part in several trainings specifically for emergency preparedness that have been offered by several of the agencies. And You know, actually, I wanted to say before I say this, along the lines of what we were talking about earlier, I would love to see and know of how to get access to some of those trainings on what to do after a disaster. You know, we always focus on this is a disaster here and now, let's fix it, but there is a lot of mental stress and there's a lot of health-based stress that can occur in the aftermath, and I really think that that's something that we really should be focusing on. So I appreciate you bringing that up. I've seen that, back to the question, resilience on the ground, because of the trainings and because of how in-depth they are, for instance, CERT training, which I think is fantastic, it gives everyone the basic toolkit, if you will, to not panic, not freak out and get really upset about what's happening, and realize, you know, if I just take a deep breath and I just stop for a second and I think, we'll get through this, and there's going to be 10, 20, 30, 100 other people that are going to want to do the exact same thing, and we're just going to align ourselves, and it just gets done. It's, you know, one of the wonderful things, we talk about the desert honeybee, and we talk about how you have that mentality of working together allows you to overcome incredible obstacles. And because of the trainings that we have had and the ones that we continue to receive, and now because of this very conversation, the ones that we're going to start looking into, I think that it has had tremendous success on the ground in disaster times, but also, as you mentioned earlier, just in regular life. Things happen, financial crises, deaths in the family, mental illness. There are so many struggles that we deal with, and as we prepare all around, you start to find that there's an overflow into those areas.
Thanks, Sinjin. I'd love to get Dan's thoughts on this too, because I think that we're in the middle of what I hear is like almost a theme around what we can do right now. Everyone on the phone. I understand that there's 151 of us on the phone right now, or on this Google Hangout, I should say. So this sounds like something we can do starting this evening. And Dan, I'd just love to hear your thoughts on this.
Well, what can we do starting this evening is one question, and what can we do to promote long-term recovery is maybe a little bit different question. In
Right.
terms of what I think we can do this evening, I do think the CERT training that St. John mentioned is perfect as an example of something, and I actually think it's the kind of thing that faith leaders could really be instrumental in, because it's exactly the kind of thing that a congregation could sponsor, and it would be a great opportunity to bring your community together. And I really think both for short-term, what can we do now, and for long-term, the answer is the same. We talked a little bit about the research before, and what the research is really beginning to tell us is something that we all have known all our lives, which is when community members know each other and are friends with each other and are connected to each other, they do better in a disaster. They respond more quickly, they recover sooner, they just function a lot better. And so I think the answer really is, what can we do, what can a congregation do, what can individual people do that promotes the sense of community? And I think one thing you can do tonight is you can make a mental list or even a written one of everyone in your neighborhood and say, is there anyone in my neighborhood who maybe might need a little extra help in an emergency? Maybe there's someone in a wheelchair, maybe there's someone who's caring for a frail elderly relative, maybe there's a single mom with a whole bunch of kids that aren't always at home at the same time and may need to go get picked up from a school. These are all kinds of things that I think many of us, if we reflected a little bit, probably could answer. And if we can't answer them, there's a great excuse, right, to go get to know your neighbor, so you can do that. Not to proselytize, not to have any agenda beyond simply knowing your neighbors and recognizing, as St. John was saying earlier, that if we know them and they know us, then they may be able to help us, because maybe one person in the neighborhood has a really good generator, and maybe someone else in the neighborhood, you know, always has an extra 20-gallon can of gas in the garage. Or, I mean, it could be anything, right?
Next to a Mormon?
Well, those are maybe highly relevant examples, but you know what I'm saying is, like, we're really talking about like basic steps, but the steps are towards a goal. which is when you build social cohesion, when you build social capital, when you build connections between members of a community, within a faith community or within a geographical community, anything that builds those connections is going to really promote, what we're seeking to promote here. And I want to take a moment here to talk a little bit about health in this context. We've talked about the National Health Security Strategy. We've talked a little bit about mental health. But I really think it's important as we think about strategies for promoting recovery, for promoting a better response, and of course for promoting long-term resilience. We're talking about health. I mean, so many things that support our social connectedness support our health and our well-being as well. So, for example, knowing if you have neighbors who have health concerns, not to pry, of course, but simply knowing people who may have additional needs, knowing how to take care of our own health in an emergency. If you could make a list of what are the 10 things you need in order to remain healthy in the absence of being able to bring things in from outside your home or being able to go to Walmart or Target or whatever, what are the things you need? Is there a medication you take every day? Is it vitamins you take every day? Does your child have any special need? I mean, all of those things that are about promoting health.
Well, it kind of seems like, too, if you're healthy, like if you're just healthy, if you get yourself to your optimal health somehow, which means you're getting you're seeing your doctor regularly and having your annual physical, you have your immunizations, you're eating well, you're not smoking anymore, and all these things, right? You've now got your body in good shape so that it can be of use during this. So that instead of, not all of us have that liberty, right? Like, not all of us can control, like, get it all the way to optimal health and be the person that can serve. So, and it could be that for some of us, we could decide, well, I have that kind of body, and I could be of service using that if I were just a bit healthier.
Yeah, but
go ahead, Marcus.
If I can add, I think that it's very important to note, though, that when we talk about the unique needs of community, that it's vitally important that we remember that we have to be inclusive in our response, and that there's not one type of health or one type of physical ability that makes one community more resilient than another. I just wanted to do a very quick interjection back to the question about the progress that's been made in enhancing the community resilience from the faith community, and I'll broaden this to the voluntary agency community. The National Voluntary Organizations Active in Disaster is a great example, I think, of the progress that's been made. These are groups like the American Red Cross, Salvation Army, Islamic Relief USA, Southern Baptist, that it all come together. It's about 110 groups in all, but they're responding to the needs of the community after a disaster. And they're focusing on community preparedness now. They also have a committee on health. So I think that's a great example from the faith-based and voluntary agencies perspective of the amount of progress that's been made really long before we talked about resilience. And it's something that I think we should be mindful of. I know LDS Church is also an active member of the National VOAD member and the movement. And it's a great opportunity for faith leaders who may not necessarily know where to start. They have state VOADs as well, is what they call themselves. And it's a table that already exists of voluntary organizations and faith-based organizations seeking to have conversations about this idea of how do we be more resilient, and how can we help our communities inclusively recover together as quickly as possible after an incident.
And this is Dan. If I could just add in something building really on what Marcus was saying, I think it's really important to remember that that because people have an access or functional need doesn't mean that they can't be part of the community's response. And I know you weren't implying that, but I think, for example, a lot of faith-based organizations provide services in communities, and they really know who the people in need are in community, people who maybe have a transportation need or a communications need or some other need. And those organizations that serve them also know the strengths in the people that they're working with. And often, as I said, someone, for example, who's housebound may also be the person who has a generator and does other things because they've had to make their home a place that they can stay in for long periods of time, even during an emergency. So I think we have to be very careful not to assume because someone has a disability or another challenge that they don't also have strengths. But having said that, even people who really do have access and functional needs who are going to require extra assistance during an emergency, we certainly want to recognize that we have to be sensitive to their needs, but also make everybody a partner in that process. And as we plan how we're going to help our communities, how we're going to reach out to our communities, we certainly don't ever want to adopt an attitude of, oh, those are the needy folks over there, let's go
Right.
and tell them how we're going to help them.
Exactly.
That any kind of planning, social cohesion, social connectedness, it's also about respecting every member of the community. So we certainly want to make sure that we have that approach as we think about all of these things.
I couldn't agree more, and I'm really grateful that you guys clarified some of that. So what I said could be misconstrued, and I would hate for it to be, but obviously I'm the child of two very hard of hearing parents and a friend to the deaf community, and here in DC live just actually down the street from Gallaudet, and even in our disasters here, the deaf community has stood up and been very, very helpful. So I agree, and thank you for that clarification. We're getting some questions over Twitter, and if you don't mind, I'd like to kind of switch over to there. One of them is just, will we be given the email address of the panelists? And I'm happy to give you mine. It's kimberly.konkel, Konkel, at hhs.gov, and we can send that out to you. And I don't know if we want to do that and waste all that time doing that, but we will definitely be able to send this out, send people some type of list. Well, I don't know how we find who's on here is my question, but.
So maybe what we can do, just Kimberly, you've given out your address, so in the interest of time, instead of having us all do it, if you wouldn't mind
Absolutely.
just forwarding questions to us. I'm happy to respond to any questions, as long, we just want to make sure we have some system for doing it, but I'm happy to respond to questions. I will say too, just a little plug, my website for my division is the.gov, is all public health emergency preparedness information from HHS is at PHE, which stands for public health emergency.gov. And if you go to phe.gov/ABC, which is the acronym for my office, there's a lot of information about community resilience, behavioral health, and at-risk individuals, for example, children, seniors, people with disabilities, etc., in emergency preparedness.
Thank you. Marcus, you look. I keep.
Yeah, I was gonna ask actually, and this is actually a question for St. John. Just so. We talked about social connectedness being important, but what are some basic ways from your perspective, in addition to things like CERT training, that faith leaders can empower themselves and their leadership to be more responsive to the needs of disaster survivors, before an incident or anything happens?
There we go. That's actually a very interesting question. In our religion, we feel prompted that we're guided by the Spirit to make decisions to be able to help people. And I think that stems from a couple of things, but most importantly that we have a lay membership. So when we serve in our church, we all have day jobs, if you will, and we all do other things. And it's actually, you asked that question, and I can honestly say that we need to ask it with another question. I would be interested in finding out what other programs there are to help us be able to be better equipped to help those people, because I think it's beyond being kind and caring and offering assistance in any way necessary and things like that. I think that there have to be, from the conversations we're having, so much more in the way of training and programs that we can utilize that we maybe do not utilize as much as we do now. So I'm going to turn that back into a question to you and say, what would you suggest that we look into as far as above and beyond, obviously asking, how are you, what can we do to help? What other things are that we can look at, maybe indicators or things like that we're not aware of?
Well, I'm going to intercept your punt and throw out a Twitter question that I think feeds into there, which is, and we can keep going on these tools question, but I think this question is quite relevant. It was, with the new and improved FEMA app and the most recent trend in mobile being going offline, what sort of information would the faith-based industry or community see as a critical content from their perspective, if any?
So I see two questions in that, and I think that one of them is we'll focus on access to preparedness information via digital engagement. So not only does FEMA have an app, but American Red Cross has great apps that talk about hurricane preparedness, wildfire preparedness. I know HHS has great resources through their Lifeline piece, and then there may be some other apps as well that we'll send over to promote to people. But there's a lot of information that's actually gone digital, and I think that that's provided a very positive response and has allowed us to engage the public in a different way. Most people have smartphones. I have my phone right here. And it's very important to use those apps. But then in addition, it also provides really access to information, particularly when we talk about getting information from your local emergency management and public health officials. Many cities and localities and states have invested in alerts and warning systems, and it's a very small preparedness action, but that app actually allows you to hear directly from your local emergency manager, local first responder community on any updates if you have a severe weather incident. It can be from a flash flood warning to a tornado to evacuation orders if possible. So I think that that's the first part of the question. As it relates to going off of the grid, I think a very important thing is, and I think we've seen this in Sandy and we're going to see this more frequently, one of the most important tools to individuals have become their phone. So when the power goes out and it's been more than 3 to 4 days, it's very difficult to stay connected with just the phone. So really it's going back to the basics, having a basic family communications plan at the individual level, but it could be that your house of worship invest in looking at how can we as a congregation communicate with one another using the tools that we have in the instance that we aren't able to necessarily call out because everybody's on the phone. Maybe there's a text message phone tree that you set up for your house of worship. So there's a few creative ways to look at it, but I think that when we talk about going off of the grid, it's really a lot of the basic skills that have helped people get connected long before I could Facebook, email, tweet, join on LinkedIn, and reach somebody via, my other email account. That'll be helpful for faith leaders to stay connected and help communities stay connected.
And I'll throw out just a couple of other resources that I think might be of use to folks. There is actually a really, really good number of apps that you can access via the National Library of Medicine, which is nih.nlm.gov, which is National Institutes of Health, National Library of Medicine. There are so many good disaster apps. There's a whole page of just apps related to mental health in disasters. SAMHSA has actually put out one that's really amazing. It has the ability to find services, to upload information about sort of anything from talking to teachers about disasters to what can you do as a parent to you're a first responder, hurricanes, tornadoes, whatever. It's quite comprehensive information. And there are some amazing apps out there that have been sponsored, as Marcus was saying, by government. I also I don't want to value any one contribution over another, but I do think that the Humanitarian Disaster Institute at Wheaton has done some good work. I'm going to put this up on the screen. I don't know if people can see it or not. Is it? Because I can't look at the thing and see. But anyhow, this is just an example of some of the good work that's being done out there. Is it kind of readable? So it's a public health planning guide for faith communities. It's just an example. And obviously the folks there are doing good work in conjunction with Cook County and Chicago near Wheaton. So I think that there's also good work being done now that's really trying to focus specifically on ways that the faith community can get more engaged in the planning side, because I think, as Marcus was saying, it's a saying that we all have in disasters, like during the disaster is too late to be passing around business cards. Like, you got to know people in advance if you really want to respond effectively and have a good response. So I think it's really important to engage in planning in ways that make sense and that are also to scale with your organization or your congregation, because obviously the leader of the congregation has to know what you can and can't take on, because you don't want to start something that you can't finish. And I think that some of these kind of guides will also help people think about, okay, what's reasonable for my congregation or my organization to do and give you some steps on how to do it.
For sure. And Kimberly, if I can answer, say, John's question a bit more directly as well in terms of like what tools are available or what actions can they take. So you had mentioned earlier, right now we're in the middle of Hurricane Preparedness Week. So for those who don't know, June 1st kicks off the beginning of the Atlantic hurricane preparedness season, and that runs till about the end of November. So one of the things that we always do is that there are a lot of different awareness campaigns, and one of the major campaigns that many people on the Google Hangout may be familiar with is ready.gov. Make sure I have that up there correctly.
We can see it.
And of course, so www.ready.gov, and that's the campaign that really has provided the foundation to take action, get a kit, make a plan, be informed. To that point, what we've done is, again, so we have Hurricane Preparedness Week, there's Earthquake Preparedness Month, there's Severe Weather Awareness Week, there's Flood Awareness Week. All throughout the years, there are these opportunities for localities to really increase awareness. And what we're doing with America's PrepareAthon, which I will plug right here, is encouraging people to be smart, take part, and prepare, and a lot of the things that are already happening. And we're encouraging specific actions that people can take for specific hazards. During our National Day of Action, we had about 5 million people across the country engage in some form of action, be it as simple as downloading a preparedness app, which actually is very helpful. You can download the FEMA app for sure. But then it's also been as comprehensive as having small town or citywide practicing an evacuation plan either in your school or in your building. And we know, research tells us that if people practice a particular behavior, it's more likely that in that moment of an incident that they're more likely to know what to do. And then for a faith leader, you think about all the decisions that faith-based leaders have to make every single day, again, from feeding the homeless to being concerned about their parishioners to what meetings they have to attend. If they're able to practice some of their decision points and just knowing how they would respond to something like a hurricane, which is coming ahead of time, or respond to a no-notice event, such as an earthquake, practicing how to walk through those decision points can make a faith leader a lot more effective in that time during a disaster. So America's PrepareAthon is, there's 2 national days of action. The first one was April 30th. The next one will be September 30th. And that can be a great time for faith leaders to really think about what are going to be my top 3 decision points at the time that our community is impacted by a disaster or a nearby community needs our help. And there are great tools and resources, again, on ready.gov. And then also you can join ready.gov/prepare to access the PrepareAthon website. And there's a suite of tools specifically for houses of worship available there that can help, I think, faith leaders think through and get ideas for how they can engage in resilience and preparedness.
Wow, thanks, Marcus, for sharing that. And I'm sure we'll get that out on Twitter, too.
Thank you. That was very good information, Marcus. Appreciate that.
Welcome.
So turning now to another question that we got we got this via email, and it was, how can a community promote health? Is the question, the way they wrote it is, how will you empower community participation in relationship to health promotion?
I guess that's probably a question for me, at least to start with, so I will do my best. I mean, obviously there are so many ways that health is promoted, and I think it really does have to be a community effort. Obviously, there are, let me just give you an example of one of the ways that we've tried to bring the health community together in relation to emergency preparedness. HHS has 2 major planning grants related to health in disasters. One is from the Centers for Disease Control and Prevention, CDC, which focuses on public health, and the other one is from my agency, the Assistant Secretary for Preparedness and Response, which focuses on hospitals and healthcare systems. And the hospital and healthcare system, or HPP preparedness grants, really focus on building coalitions. How do we pull together the members of the healthcare system in a community to do more organized planning? And by doing that, the idea is that people won't be forgotten. We've talked earlier about really having a community-based approach, that if the people who provide healthcare in a hospital and the people who provide healthcare through outpatient clinics and the people that provide healthcare through home delivery systems, like, for example, home nurses, if the folks that either are or represent those different kinds of healthcare service delivery systems can come together and talk about planning and emergency preparedness, then in an emergency, they'll be better equipped to make sure that the health needs are being met. For example, there may be only one hospital that has good pediatric capability. But in an emergency, if that's the hospital that, say, is hit by the tornado or flooded in the hurricane, or loses its power due to the snowstorm, who else is going to cover children's needs in a disaster or for hospital care? If you have a coalition together, then people can begin to talk about those kinds of questions and can make plans for how they're going to really meet the needs of their community. So I think one way to answer the question about how do you promote health, how do you promote health care in a disaster setting is you got to bring people together. And I would argue that you have to bring together not only the people who provide direct health services, but people who provide the kind of services that support health. Often those are thought of more as social services or human services, but frankly, those services support health. If you don't have transportation to and from your doctor's appointment, well, transportation is a social service, right? But if you don't have it, you don't get to the healthcare. You don't have health. So I think that there are ways that when we think about the healthcare system, we really have to think about it very broadly. And there are a lot of social services, human services that support health. And I think bringing those people together, and frankly, I think the faith community is often a big part of that, particularly in many communities where the leading social service agencies are often faith-based, whether it's Catholic service, Catholic charities, Jewish social service. I mean, there's a number of faith-based organizations who really are the primary social service providers in their community. So I really think the faith community, the social service community, the health community, they can all come together to promote health.
Thanks. St. I'm just wondering how that resonates with you. You're on mute.
It resonates very much. I got the mute button in the end there. It's interesting, as you mentioned, social service. We talk about health and the ancillary things that we need in order to promote that health or keep the process of healing alive. Part of the being prepared is getting to know your neighbor, but part of surviving the struggle, I think this is helping me even answer my own question in a way, is the fact that you stay in contact, you stay in communication, and as you do that, you are still willing to help, which in the end just promotes a stronger sense of social relationship and well-being in a community because, oh, you need to go to the doctor, well, great, I'm going that way, let me pick you up, let me take you there. Something in our community, especially in our faith-based organization, is the fact that we have a lovely is the wrong word, we have a wonderful structure that is set up. We make sure that people are fed if there's an emergency in a family or something happens. Something that we're very well known for is green jello, but is food. People, something as basic as food can be such a blessing in times of need because you didn't have to prepare it, or you were able to focus more on the disaster emergency you were facing in your own personal life. So it resonated because it makes us remember that a disaster is not the only reason for us to communicate with one another and to get to know each other and prepare. That is not, it's an ongoing thing. So
we don't just use each other for our gain, I guess.
Right. And if I could just add to that point, I think that it's important to note, to St. John's point, particularly from when we talk about the engagement between the faith community and voluntary organizations and government, that we acknowledge from the government perspective of just meeting faith leaders where they are and understanding that a disaster or an emergency is not going to be the first thing on their mind, but understanding what those needs are and providing those opportunities to address other needs. So, for example, I think public health and focusing on health can provide a very great opportunity for local government officials to establish that relationship to community needs for that particular congregation or that house of worship. So I can't emphasize this point enough, but I'll leave it there for now.
I'm really glad you are, because it's a very good point to emphasize. We've got a question that comes from rural Alaska, I believe, and they're just talking about essentially like the difficulties and the differences of emergency response in a rural environment where some of these technology tools that we're talking about don't work as well, and if you have any suggestions or advice there.
So I have one program, and it actually comes from our friends out of the state of Washington. They have this wonderful program called Map Your Neighborhood, which really looks at and focuses on this idea of neighbor helping neighbor. Rural communities, and from my experiences, have been some of the resilient just because they know up front it may be 1 to 2 miles to the next person's household, or they may be a few miles further away from critical services, unlike urban and suburban areas. But Map Your Neighborhood, I think, is a good organizing tool to begin to think through as a community, what relationship should we have as neighbors, and though we may have services 5 to 10 miles away, what conversations can we be having now, so that way we have appropriate expectations set for what we're going to do as a community and what government or other organizations can do to help us in the event that the incident that's happening is beyond our span of control. Again, I think it does come back to kind of fundamentals. I can probably learn more being in a rural community in terms of what being resilient means, just because that's naturally their predisposition. But if you're looking for a specific tool that can be applicable not just to a rural community but to other areas as well, I think that the whole state of Washington Map Your Neighborhood tool is a wonderful example of kind of taking it away from relying on the phone, relying on the internet, and really allowing for that neighbor helping neighbor interaction. That's a critical part of the whole community philosophy.
Thanks.
And I will say, too, the state of Alaska has actually got some really, really great people and some really good recent experience. There was just a huge national emergency preparedness exercise in Alaska, which actually was at the same time as the mudslides in Washington. So you had the people in the Pacific Northwest doing kind of double duty, monitoring and exercise in a real-world event at the same time. I'm actually going to be sponsoring a webinar on pediatric preparedness on June 19th, which you're all welcome to join if you'd like. And we're actually going to have the state public health coordinator for Alaska on that call, and I think she's got some really good ideas about how, in that setting, you can do better preparedness for children in disasters. So I will say that there's I think at the state level in Alaska and in every state there are really good people. And maybe if you want to follow up separately via email, maybe we can put you in touch with some of the state level planners. If you're in a state where you're kind of struggling with how you could plug in, and perhaps we can connect you to some folks that might be able to provide more information.
Thanks, Dan. And to follow up with that, because I know this is a area of expertise, could you just give us a little intro to the things that we need to be considerate of for children during a disaster?
Yeah, so first off, on my webpage, www.phe.gov/abc, there is, we have a lot of information. We have a whole page that's on pediatric preparedness that says who your state American Academy of Pediatrics kind of lead is, as well as who your state disability integration specialist. So there's a lot of really good information and a webinar on that page. I think in terms of thinking about children and preparedness, I think that there are a couple of things that you probably want to think most about. First off, children obviously take their cues from adults during a disaster, just as they do pretty much 365 days a year. I mean, we all know when mom and dad are having tension, that's when the kids are more likely to fight. We all know that children are kind of barometers. So certainly I think the first thing to remember is, as a parent, the more that you can stay calm, or as a teacher, the more that you can stay calm, stay informed, etc., the better able you're going to be to help children. So I think that's just sort of a basic thing. Children aren't going to go off in left field. They're going to read their cues from adults. During an emergency, I think there's some really basic things that are useful to think about with children. First off, children don't process information the same way that adults do. For example, with young children, when they see an image of a plane going into a building, as we saw on September 11th over and over and over again, they're not able, particularly very young children, to recognize that that's the same event being just repeated, and they see each one as a new event. So it's as if planes are crashing into buildings all over the country. And that's obviously incredibly frightening for children. So I think one of the biggest things in a disaster is to really be careful of children and their media consumption. And I think even though adolescents appear just like adults, sometimes on the outside and even in the way they talk, sometimes their thinking isn't as sophisticated. And so I think it's really important, even with older children, to monitor media attention. It's just is a good basic rule. I think beyond that, the things that are most important to recognize with children is, as they are in any other time, when they're stressed, they tend to regress. So, you know, a 2-year-old might suddenly start crawling again, or a 5-year-old might start wetting the bed, or a teenager might start isolating and not wanting to socialize as much as usual. So I think those are the kinds of things that you often see with children in disasters, is that they tend to take a step backwards. And I think as an adult who cares for children, you just want to make sure that you are paying attention to those kinds of things. In terms of planning and preparedness, I'm happy to say that we've made so much progress as a nation in the last couple of years in being much more inclusive. At 5 or 10 years ago, we weren't really thinking about children. I mean, even most of our ambulances didn't have pediatric-sized equipment. You know, things as simple as a cuff to take blood pressure, etc., on the scale that we would need, you know, in a disaster. We just weren't thinking about kids in the way that we are now, and I really am. We're doing so much more in terms of, you know, for example, having liquid formulations of medicines that might be needed in a disaster, things like that. So I think we've made a lot of progress. I think the important thing to remember is, you know, from a planning perspective, is kids are not just little adults. They see the world differently. Their bodies are different. And I think from the faith community, I think that really the key message is to think about where are children going to be during a disaster, and how can you work with the people who take care of children, whether it's in school, in Sunday school, whatever, to just understand what their unique needs might be.
And then if I can add to that, I know that FEMA, HHS, Department of Education, the Red Cross, we've been looking for a long time at how we can not only assess the needs and help children after a disaster, but really empowering and uplifting those youth that are leading the nation in preparing individuals. One of the things that research talks about is it's actually children that typically bring the family plan home to their parents to get them to actually make a family plan. And so while there may be some unique challenges to those youth that are impacted after a disaster, there's tremendous opportunity for the faith community to support their youth getting engaged in preparedness long before an incident happens. To that point, FEMA is actually going into its 3rd year. We just announced our new Youth Preparedness Council members, and these are youth from across the country that do phenomenal work on preparedness for many different levels. If you want more information, there's a whole suite of tools if faith organizations are interested in engaging their youth in preparedness. Go to ready.gov/youth-preparedness. or ready.gov/kids. And again, it's been done in partnership with HHS, with the Department of Education. It's been a wonderful, not just intergovernmental effort, but really a whole community effort to address those needs in response to recovery time, but really to uplift, empower, and honestly give the necessary due credit to youth that are at the forefront of preparing communities.
That's fantastic. Thank you so much. I was recently at a conference and met some students from a number of universities actually, who had developed a tool using, and it's the innovation in youth right now to develop apps, I think is pretty exciting. And they had developed a tool that they were able to, this was in Cape Town, South Africa, but in these rural spaces were able to link trained community health providers who'd been trained just briefly in the little bits of what to do in an emergency. When there was an emergency, the lead time had been 20 minutes, and they got it shortened down to 2 by just having kind of the community engaged and creating a way for the community to network. And I think each community is going to have some different tool, but I'm really grateful that at the end of this conversation, we're finishing on our children, who really, I think, we're preparing in a lot of ways for them, but in so many ways they also need to be part of it and are leading us there as well. So this has been a really wonderful experiment in Google Chatland or Google Hangout, and I'm grateful for all of our participants. We're at the end of our time. We will be following up with tweets, and you can reach us again at all of our various websites that have been shared. And you can get us directly at partners@hhs.gov, or partnerships, sorry, at hhs.gov. And so partnerships at hhs.gov, and hopefully we'll tweet that out too. Thanks you all for joining us. It's been a real pleasure. I hope you have a good evening and help us as America continues to prepare.
Thanks.